like to welcome everyone to meeting number 25 of the House of Commons Standing Committee on Health. The committee is meeting today to study the Supplementary Estimates C 2020 to 2021, votes 1C and 5C under Canadian Food Inspection Agency, vote 5C under Canadian...
Excusez-moi, Monsieur le Président.
Sorry to cut you off, Mr. Chairman, but there's no interpretation coming through, and I'm on the right channel.
Merci. Is the translation coming through now? Are we getting translation? Let me start again, and we'll see if we get a thumbs up from Mr. Theriault. So I call this meeting to order. Welcome to meeting number 25 of the House of Commons Standing Committee on Health. Are we getting translation? No translation? So the clerk is going to check on that.
Okay, you can go ahead. I think it's resolved. Go ahead.
Okay. Thank you, Mr. Clerk. So once again, I call this meeting to order. Welcome to meeting number 25 of the House of Commons Standing Committee on Health. The committee is meeting today to study the Supplementary Estimates C 2020 to 2021, votes 1C and 5C under the Canadian Food Inspection Agency, vote 5C under Canadian Institutes of Health Research, votes 1C and 10C under Department of Health, and votes 1C, 5C, and 10C under Public Health Agency of Canada. I would like to remind everyone that you have the right to participate in these proceedings in the official language of your choice. I would emphasize that in the event that there is difficulty in hearing translations, please bring it to my attention as soon as possible, as Monsieur Theriault has just done, so that the matter can be resolved. I would now like to welcome the witnesses, or I'll rather welcome back the witnesses. So today we have the Honorable Patty Hajdu, Minister of Health, and supporting the Minister today we have from the Canadian Food Inspection Agency, we have Dr. Sidika Mitani, President. From the Canadian Institutes of Health Research, we have Catherine McLeod, Acting President. From the Department of Health, we have Dr. Stephen Lucas, Deputy Minister. From the Public Health Agency of Canada, we have Mr. Ian Stewart, President. Dr. Theresa Tam, Chief Public Health Officer. Major General Danny Fortin, Vice President, Vaccine Rollout Task Force, Logistics and Operations. And with that, I will invite the Minister to for her statement, and please, 10 minutes, please. Minister, go ahead.
Well, thank you very much, Mr. Chair. And I will do my speech in English to avoid having to flip back and forth between the channels. I appreciate the invitation to appear before the HESA committee. And I will just let you know I have many departmental officials joining me today, including Dr. Stephen Lucas, Deputy Minister, Ian Stewart, President of the Public Health Agency of Canada, Dr. Theresa Tam, Chief Public Health Officer, Major General Danny Fortin, Vice President, Vaccine Rollout Task Force, Logistics and Operations, Dr. Sidika Mitani, President of the Canadian Food Inspection Agency, and Catherine McLeod, Acting President of the Canadian Institutes of Health Research. When I appeared before the committee last month, I provided an overview of Canada's COVID-19 vaccination strategy. And today I would like to begin with a brief update on COVID-19 vaccinations and the situation in Canada right now. So far, we've delivered more than 3.8 million doses of COVID-19 vaccines to provinces and territories. And more than 2/3 of these, a total of 2.6 million doses, have already been administered. And we expect these numbers to rise quickly as deliveries from vaccine manufacturers continue to ramp up this month and in the months to follow. The recent authorizations of the AstraZeneca and Janssen vaccines by Health Canada give us 2 more tools in the fight against the pandemic. Following the authorization of the AstraZeneca vaccine, the Minister of Public Service and Procurement announced that Canada has secured 2 million doses through an agreement with Verity Pharmaceuticals Canada Inc. / Serum Institute of India, and this is in addition to the 20 million doses already secured through an earlier agreement with AstraZeneca. The Janssen vaccine is administered in a single dose and can be stored and transported at regular refrigerated temperatures, and Canada has an agreement with Johnson & Johnson for 10 million doses of this vaccine between now and September. Although we've seen a decline in COVID-19 activity from mid-January through mid-February, daily case counts have since leveled off, and COVID-19 variants could threaten the progress that we have made if we relax public health measures too soon. And that's why we all need to keep following public health measures that we know help identify and stop the spread of COVID-19. This includes testing, screening, contact tracing, and of course, isolation. We also need to keep doing our part to protect each other. It means continuing to wear masks and limiting our interactions with other people. Canada also has strong restrictions for travelers arriving in the country. In addition to being tested for COVID-19 before they arrive, travelers must now take a test on the day they arrive in Canada and another on day 10 of their quarantine. All positive tests are evaluated to determine whether they are variants of concern. These strengthened requirements help protect the most vulnerable Canadians. And I want to thank the many Canadian travelers who are doing their part to protect their neighbors by following these new rules. From the very first day, this pandemic has required us all to adapt and change our behaviors to protect public health. Canadians as individuals have had to do it, and so too have governments. As the pandemic has evolved, the federal response has evolved as well, and our budgetary needs reflect this. I will now provide you with a financial overview for 2020-21 as set out in the Supplementary Estimate C. Through this exercise, I'm seeking $684.5 million on behalf of the health portfolio, which includes Health Canada, the Public Health Agency of Canada, the Canadian Food Inspection Agency, and the Canadian Institutes of Health Research. This increase over the 2020-21 main estimates will complement work that is already underway in a number of important areas. Beginning with Health Canada, I'm seeking an additional $603.1 million. This will increase the department's statutory spending by $553.6 million and its voted spending authorities by $49.5 million. And this funding will be used to address pressures associated with Canada's COVID-19 response, as well as our obligations under the Economic Statement Implementation Act 2020. This includes investments in long-term care, mental health, and substance use in the context of COVID-19, as well as supporting innovative approaches to COVID-19 testing. For the Public Health Agency of Canada, I'm requesting a total increase of $66.5 million. This reflects an increase of $5.634 billion in voted authorities, which is offset by a decrease in statutory spending of $5.567 billion. The increase in voted authorities will go towards innovative research and the procurement of testing technologies related to the pandemic, surge capacity, and support for mental health and substance use initiatives. For the Canadian Food Inspection Agency, or CFIA, I am seeking $13 million. This will increase the agency's statutory spending by $1.8 million and its voted spending authorities by $11.2 million. The majority of this funding will go towards improving existing domestic and import safety control systems through increased surveillance and inspection, supporting Canadian exports through the inspection and certification of goods, and the ongoing digitization of the agency's internal and public-facing business. Another $1.5 million will support the Canadian Food Safety Information Network, which will improve confidence in the food safety system by connecting authorities and laboratories across jurisdictions. Finally, for the Canadian Institute of Health Research, I'm seeking $2 million. This will decrease its statutory spending by $126.7 million and increase its voted spending authorities by $128.7 million. These research investments will contribute to our overall understanding of COVID-19 and will continue to inform Canada's public health approach. Mr. Chair, it has been a long road, but with vaccination underway across the country, we are closer than we have been in a long time to a more hopeful future. The Government of Canada is working steadily towards that future with actions that protect Canadians and safeguard the progress that we've made. Health Canada and the agencies of the health portfolio are proud to lead these efforts. Our resourcing plans reflect our commitment to ensuring the health and safety of Canadians during the COVID-19 pandemic and beyond. My colleagues and I will be happy to take your questions. Thank you.
Thank you, Minister. We will now start our questioning in round one with Ms. Rempel-Garner. Please go ahead, 6 minutes.
Thank you, Chair. Long time no see from last night. Minister, how many members of the Canadian Armed Forces will be mobilized to help provinces administer vaccines in the next 2 months?
Thank you. Through the chair, Mr. Speaker, I'll turn to Ian Stewart at the Public Health Agency of Canada to talk about some of the planning underway to support provinces and territories if they need it.
Mr. Chair, a lot of work's underway for planning in that regard, and it's going to be needs-based in effect. It's difficult for me to speak, though, with respect to the plans of the Canadian Armed Forces in supporting provinces. What I can say is the Canadian Armed Forces is supporting us here, and as you know from Major General Fortin's presence, we do have a contingency supporting us here.
So would it be fair to characterize that there are no plans to mobilize any members of the armed forces to administer vaccines at this point?
No, I would not say it would be fair to characterize it as having no plans. I think perhaps it would be appropriate to have the Canadian Armed Forces talk about their support to this initiative.
I just want to know, I'm a minute and a half in, how many members of the armed forces will be deployed or mobilized in the next 2 months to help administer vaccines?
Well, Danny can speak to how many are currently deployed with the Public Health Agency, and then you're asking us to speculate on what will be required.
That's fine. I got what I needed. Minister, how many pharmacies will be administration sites for vaccines by the end of April across Canada?
Well, thank you, Mr. Chair. Through you, I'll say that the provinces and territories are, as you know, as the member knows, responsible for administering vaccines. We work closely with them to ensure that they have the capacity and the supports they need. I'll turn to Major General Danny Fortin to speak about some of the tabletop exercises with the provinces.
That's okay. That's fine. So, Minister, do you have any idea of how many pharmacies will become administration sites for vaccines by the end of April?
I think the member likely realizes that provinces and territories administer vaccines. Of course, we've been supporting the provinces and territories with their planning. I have an official that is actively involved in this planning and would be happy to share more details with you.
I'd be happy to have that plan tabled with committee. Minister, is there any money in the supplementary estimates here to support provinces in setting up administration sites at pharmacies? Or like you're basically saying it's not your role, right?
Well, no, the member has a habit of putting words in people's mouths that is not accurate.
The minister has a habit of not answering questions. So I'll go on to the next thing. Are there any plans?
Ms. Rempel-Garner, I would ask you to let the minister answer questions.
It is my time, and I know the Liberals don't like it when I own my time, but I'm going to keep doing that. Are there any plans to deploy?
When the chair wishes to intervene, it's the chair's time. So I'm not taking this away from your time, but please do let the minister and her officials answer the questions you ask them.
Thank you. Are there any plans, Minister, to deploy federally supported mobile vehicles and pop-up clinics to deliver vaccines?
As I've answered previously, Mr. Chair, there are plans to support provinces and territories should they need supplementary support to vaccinate their citizens.
Are there any plans right now? Like for federally supported mobile vehicles and pop-up clinics to deliver vaccines?
We have planning underway. It's comprehensive. If the member would like to hear about it, we have an official that's actively involved in those.
I have 2 minutes left, about 2.5 minutes.
So the member doesn't wish to hear then the details.
They can table that. They can table that with committee. I was just asking if you had any plans to do that, but I think I've got my answer on that question. Does the federal government have any plans to set up websites, et cetera, to help people get appointments for vaccines?
Again, the member perhaps doesn't realize that it is in fact provinces and territories that have the right and the responsibility to administer health care, including vaccination.
Okay, so there's no plans from the federal government to assist in that. What percentage of people over the age of 65 have received a dose of a vaccine to date?
Perhaps I can turn to my officials for the percentage of people that have received doses. We may have some of that information. Ian, would you like to speak about the province's progress?
I've got a minute and a half left. You don't have that off the top of your head, hey,
So,
Minister?
Let me be clear. We have a ream of data on vaccination, on the planning of provinces and territories.
You came
and
here
I'm
to
more
subs,
than happy,
and
I'm more than happy to provide that information through the appropriate officials and agencies. And so, if you would allow them to have a moment to answer, we can.
You're the minister, and I asked you, and you don't have it. So, with the time I have left, I'd be happy if somebody would table that with committee. You can't answer that question at your fingertips, and it's kind of a big question. My last question, Minister. Do you agree with this statement? Even if we sustain lockdown indefinitely, which would cost lives and do immeasurable harm to our children, we would not be able to eradicate this disease, referring to COVID-19.
I'll turn to Dr. Tam to talk about the most recent research.
Yes, Mr. Chair, the coronavirus is found in every country and territory around the world. So it's unlikely to disappear from the global population for some time. And science is evolving, but that is
Minister, would you care to answer if you would agree with that statement or not?
I trust the expertise. I have a top-notch virologist as the chief public health officer, and I trust her perspective. She is far more eminent in this area than I am.
Thank you, Chair.
Thank you, Ms. Rempel-Garner. We will go now to Ms. Sadhu. Ms. Sadhu, please go ahead, 6 minutes.
Thank you, Mr. Chair. Thank you all the witnesses for appearing today. Great to see Minister Hajdu again at our committee. Today is a good day for Canada. Earlier today, the Prime Minister announced that March 22nd to May 10th, Canada will be receiving 1 million doses of Pfizer vaccine every single week. This is a good news for Canada's vaccination efforts. Minister, as you know, Grace Manor long-term care in my riding of Brampton South was one of the earliest hit, and the armed forces were called. And I understand that these facilities fall under provincial jurisdiction, but the federal government has also stepped up to keep those living and working in long-term care homes safe. Can you tell me more about the support we have given to provinces and territories regarding long-term care?
Well, thank you very much to the member. And Mr. Chair, I think the member identifies rightly that the tragedy of loss of life in long-term care is something that we'll all remember, and we've all been mourning this week and indeed throughout COVID-19. We also know that there needs to be more done, and the Prime Minister has been very clear that we will be there for provinces and territories as we move forward in the development of shared long-term care standards. But I will also say this, we didn't wait to take action. For example, through the Safe Restart Agreement, we provided $740 million to provinces and territories to strengthen their protection and infection prevention control measures. We also proposed $1 billion in the fall economic statement to create the Safe Long-Term Care Fund. We provided wage top-ups, Mr. Chair, which I think were critical to support the labor security of people working in long-term care homes. And of course, we had the Rapid Response Program where we funded the Canadian Red Cross to go into many long-term care homes in crisis and support those seniors that were struggling in some pretty difficult situations. And finally, of course, the Canadian Armed Forces. I think all Canadians will be grateful to the work they did in the first wave to protect seniors in Ontario and Quebec particularly. Thanks, Mr. Chair.
Thank you, Minister. Isn't it nice when nobody interrupts you? Minister, as you know, those Canadians living with diabetes are more likely to have a severe cases of COVID-19. Can you speak on how the government is working to support Canadians living with diabetes?
Well, thank you. And Mr. Chair, I'd first like to congratulate the member on her incredible advocacy for people living with diabetes. And we've met a number of times. I know she's done a very much work in this space. This is a specific challenge that, of course, many of us know someone who lives with diabetes. It's a disease that many Canadians face. And of course, again, delivery of healthcare falls with provinces and territories, but we're investing millions of dollars in research. It's an area where we support the provinces and territories, of course, to understand more about diabetes, not just how to prevent it, but also how to treat it, how to support people who are living with it. $230 million have been invested over the past 5 years through the Canadian Institute for Health Research. In addition to that, CIHR is investing more than $30 million over the next 7 years and new research as part of the 100 Years of Insulin, Accelerating Canadian Discoveries to Defeat Diabetes initiative. And this is an important piece of work that we have committed to people who are living with diabetes and, of course, provinces and territories so that we can, first of all, prevent diabetes, but also help support those people that are living with this disease.
Minister, while we are fighting COVID-19 as a country, we're also fighting another public health crisis. People are losing their lives to the opioid crisis across the country. We have a meeting with our Peel Police in Brampton, dealt with 7 overdoses and 3 deaths due to what they described as a bad batch of opioids. This is a public health issue. Can you tell us how your department is working to combat the opioid crisis in Canada?
Well, thank you. And through the chair, this is an area that I have been personally involved in for many, many years prior to politics. And in fact, it was under the previous Conservative government that we saw some of the cruelest changes to public policy that resulted in spikes of opioid overdose deaths, a lack of supportive care, a lack of compassion in drug policy, and indeed the criminalization of many, many people who use substances. And we've been taking steady steps to reverse those trends over the last 5 years, including by making sure that we could support safer supply centers, invest in safer supply centers, invest in programs that allow for safer consumption, community-based treatment, restoring harm reduction so that those people who are struggling with substance use and addiction know that people actually care about them and want them to get better. We're working with provinces and territories to explore legal options for harm reduction. In fact, the province of British Columbia has written to me recently exploring decriminalization. We're going to continue to be there for Canadians and their families. Listen, this is a public health crisis, as you point out, and it's something that we must continue to do as we see families struggling all across the country with substance use issues.
Thank you. Next question to General Fortin. Canada now has a 4 vaccine in Canada, each requiring a different logistical infrastructure. Can you please update this committee on how you're working with the provinces and territories and especially Indigenous communities on the logistics?
Mr. Chair, thank you for the question. We've been working quite extensively over the last 3 months plus on setting the conditions for effective rollout, starting of course, which started in December, and we continued to build this so that we have effective increase in capacity, increased ability to deliver and scale up April onwards when more vaccines become available into the millions a week, as well as additional vaccines to the 8 degrees get added. And this week, a culminating event occurred where we had an opportunity to bring together over 170 participants and discuss the level of readiness, and we'll pursue some of that through bilateral engagements in the coming days.
Thank you, Mr. Du. Nous allons maintenant, Monsieur Thériault.
We'll now turn to Mr. Thériault. Mr. Thériault, please go ahead. 6 minutes. Thank you very much, Mr. Chairman. Welcome, Minister. In light of our previous conversations, I can imagine you can guess what I'm going to ask you today. So I know that you're not in an easy position. It's difficult to convince a Prime Minister of Canada to invest in provincial healthcare transfers. It's difficult to convince a Finance Minister to be proactive and to invest in provincial healthcare transfers. But I'm reaching out to you today. The objective of this conversation for me today is to be collaborative. I've demonstrated that previously in relation to MAID. So that's my objective today, to reach out to do. And perhaps you have additional arguments that you might like to make. I'm going to raise a number of figures that will be ammunition for you to convince your colleagues. At this committee, it was established before the first wave. the healthcare networks in Quebec and in the provinces, because of the chronic underfunding, was already fragile. Then, fast forward, pandemic on the scene, we weren't ready, we weren't prepared. And the system is even more fragile to the extent, and I imagine that you agree with me on this, up until now, from what I've said, you agree? Well, so there are two groups of patients who are primarily victims of COVID-19. Those are the victims of COVID and the victims who are victims unrelated to COVID. So, and in medicine, in order to fix a problem, you have to reach a diagnosis. So that's what I'm trying to do with you now. So that means that there are a bunch of folks triaged out. Now, what does that mean if they're bumped off the waiting list? What does that mean in terms of figures? Do you know how many cases of cancer in the first wave? How many cases were just triaged out? Are you aware of that figure?
Mr. Chair, I want to thank the member for his constant advocacy for investment in healthcare. I think it's actually an important.
Excusez-moi, Madame.
Sorry, Minister, I cannot hear any interpretation. I'll just ask you a very simple question. Are you aware of the figures in that regard?
Excusez-moi, monsieur. Interpretation, correct? Mr. Clerk, would you please
Yeah, it should be okay now.
advise?
L'interprétation est revenue.
Monsieur Thériault.
The interpretation is back, Mr. Chairman. So, Minister, do you have a sense of how many cancer cases were triaged out or left undiagnosed in Quebec during the first wave of the pandemic? You're not the one that manages the services, so you're probably not aware, but there were 4,000 cases of undiagnosed cancer in the first wave. The Canadian Radiology Association indicated late October that there were 80,000 persons waiting for an MRI. In terms of scans, there were 52,000 people waiting for a scan of some kind or another. So you'll understand that we're faced with a serious problem here. Between the first wave and the second wave, well, we won't be able to deal with this non-COVID backlog. And when we're obligated to leave non-COVID cases by the wayside, it's because our healthcare network was already overly strained. So given the table that I've set for you now, don't you think that the provinces and the Quebec are within their rights to say that it's high time that you give them a bit of hope so that they can reinstitute their network, healthcare networks, and so that these folks who were left undiagnosed with cancer can in fact be treated in the upcoming year?
Thank you, Mr. Chair, and I'm hoping the translation is working now. I think the Prime Minister has been very clear that he's open to speaking about increased health transfers when the time comes. But right now, we are all focused on getting through COVID-19. And I think we've also shown as the federal government that we'll spare nothing to get Canadians and provinces through this. $19 billion is no small amount. It was for testing and tracing and data and safer long-term care homes. Including $2 billion for schools to protect students in schools, for example, another $2 billion. The investment in PPE.
Yes, I'm sorry to cut you off, Minister. I'm terribly sorry. If I may, as you're aware, I'm sorry to cut you. I'm terribly sorry, Minister. I understand that you're able to give me the list of the one-time investments. But when it comes to provincial healthcare transfers, what it's about is making Canada's healthcare networks and Quebec's healthcare network, helping them to get back on their feet, because the professional healthcare workers are burnt out. There is a shortage of healthcare workers, and people are falling down in the line of duty. The provinces, including Quebec, should be able to benefit from some level of predictability. How are our healthcare networks going to deal with these non-COVID cases? How are they going to invest in their healthcare networks when they already have to do more than they would normally have to do? It's not just this one-time funding that is helpful. It's the recurrent funding that is needed. Do you agree with that fundamental premise? It's a matter of timing, and it's not tomorrow that we should be acting. These are patients that need to be picked up as quickly as possible so that this doesn't end up being a collateral damage from COVID.
Again, I think. Oh.
Sorry, merci, monsieur. The minister may answer, certainly.
Just to say, to repeat, that the Prime Minister has been very open to increased health transfers, but the focus does need to remain now on getting through COVID-19. And we've been there for provinces and territories, clearly, with billions of dollars, with equipment, with vaccines fully paid for by the federal government, with extra support to come in and support in crisis situations. Will continue to be there for provinces and territories, including Quebec.
Merci. We go now to Mr. Davies. Mr. Davies, please go ahead, 6 minutes.
Thank you. Thank you for coming to the committee, Minister. Minister, do you acknowledge that the federal government has the power under the Emergencies Act to establish vaccination clinics?
Well, it's not, the Emergencies Act doesn't have specific designated powers in that granular way, but certainly we do acknowledge that we have a role to play if provinces and territories need that support, and we've been preparing for being able to backfill any kinds of needs that they have around vaccination.
Well, if I can quote Section 8.1 of the Emergencies Act, it says, while a declaration of public welfare emergency is in effect, the Governor and Council may make such orders or regulations with respect to the following matters as the Governor and Council believes on reasonable grounds are necessary for dealing with the emergency. And subsection G of that says the establishment of emergency shelters and hospitals. So is it your testimony here that your power to establish a hospital under a public welfare emergency would not include a vaccination clinic?
That's not what I said. I did say that there wasn't specific reference to vaccination clinics, but I also said that I don't think we need the Emergencies Act, quite frankly, to support the provinces and territories. We haven't had to use the Emergencies Act to date. The provinces and territories haven't wanted us to use the Emergencies Act, to be clear. And we have felt throughout that collaboration and support for PTs has been the best way forward. And that is exactly what we're doing. And if
okay, well, let's move to that. As we know, and as we all hope, I suppose, millions of doses of vaccine are anticipated to arrive in Canada. Now, leaving aside that it is, I think, a near certainty that some provinces and territories will have some degree of difficulty administering vaccines quickly, I think the more important fact is that vaccinating Canadians as quickly as possible saves lives. So you said that you would consider helping with vaccinations should the provinces need support, were your words. Are you going to wait until problems emerge and Canadians can't get access to timely vaccines? Or are you going to be proactive and throw the federal government as a full partner to supplement provinces to ensure that Canadians get vaccinated as fast as they possibly can?
Well, the federal government is a full partner. Let me remind the member that we have purchased all the vaccines. We have arranged for their transportation. We have delivered them to the provinces and territories. We've worked on their readiness plans. We've gone through tabletop exercises. And certainly we are preparing federal backstops if provinces and territories have any challenges whatsoever in vaccinating their population. I'd like to turn to Major General Danny Fortin, who could speak a little more about those details.
That's okay. I'd like to focus my attention on you if I can. Well, Minister, again, you're going to wait until the provinces have problems. Is that really the best way to deal with this, as opposed to, you know, the Prime Minister talks about a Team Canada approach. Well, Team Canada without a captain is missing a major partner. I mean, why doesn't the federal government proactively get involved with the provinces, supplement them with federally funded vaccination sites? Do you think any provinces will refuse that? Will they disagree that their citizens can't have access to more vaccination sites so that they can get access to vaccines quicker?
I think that the member maybe doesn't understand what I'm referring to when I say full collaboration and support. In fact, let me just reiterate, we purchased the vaccines, we delivered the vaccines, we worked with provinces and territories to ensure they had readiness to set up those vaccines. We've supported augmenting their data systems. We've been there every step of the way. We will continue to be there. Major General Danny Fortin interacts with every single province and territory to understand how they are faring with readiness. And of course, we'll be there. And if there are
Okay.
problems identified, those problems can be worked out
I
together.
think
And the federal government has been very clear that we will be there in a heartbeat should we need to support
Sure.
provinces and
I
territories
understand
in
your
their
position, Minister.
responsibility to deliver healthcare
Okay.
in their jurisdictions.
Okay, now,
Furthermore,
Minister,
I'll just
sorry,
say,
Minister,
Danny
I have limited time, and I got your answer. Now, the Liberal-appointed Hoskins Advisory Committee on the Implementation of National Pharmacare recommended that federal, provincial, and territorial governments launch a national pharmacare no later than January 1, 2022. by offering universal public coverage for an initial list of essential medicines and then expanding to a comprehensive formulary. Will your government honor this recommendation and meet the deadline of January 1, 2022?
We are working as we speak on standing up the Canada Drug Agency, and that agency will be responsible for working on a formulary with provinces and territories, and that work is underway as we speak. It would be premature for me to set a deadline and our capacity to meet that particular deadline. I'm sure the member understands that we've had a year of disruption in terms of consultations and the ability to move forward, but we are indeed moving forward.
So on another deadline, on November 26, 2020, I asked you if your government was prepared to finally move forward with amendments to Canada's patented drug price regulations on January 1, 2021. That would save Canadians an estimated $6.2 billion over 10 years. At that time, your government had already postponed those changes twice. You said this, the changes to the PMPRB are going forward. We agree with the member opposite that we must have lower drug costs for Canadians. Yet on December 30th, not a month later, you reversed that position and once again delayed implementation of those reforms. Why?
Mr. Speaker, perhaps the member doesn't realize how disruptive a pandemic has been to the process of consultations and the process of working in partnership, in particular with pharmaceutical companies that are right now pulling out all the stops to deliver vaccines for world citizens. This is the priority of our government, getting people vaccinated, making sure that we have the capacity and the tools needed to get people vaccinated to protect Canadian health. In fact, those amendments are slated to come into force on July 1st.
We've heard that before.
Thank you, Mr. Davies. We'll start round two at this point with Mr. Barlow. Mr. Barlow, please go ahead, 5 minutes.
Thank you, Mr. Chair. Minister, in relation to the requested voted authority amount of $225.5 million for quarantine hotels, is the $2,000 being charged to Canadians a means of cost recovery?
Well, thank you, Mr. Chair. The amount varies that a Canadian will need to pay for the stay in a quarantine hotel, and it is set and determined by the hotel in which they choose.
So you don't know if it'll be a cost recovery for that person who goes. I mean, we kind of heard that number between 1,800 and 2,000. So you can't say if that's
the money doesn't go to the government of Canada. It goes to the hotel who's providing the services. They are contracted services.
Okay, what is the $225.5 million going to cover?
Well, there's additional supports, of course, for the travelers themselves. There's additional supports for the hotel associations and a variety of other supports in terms of booking, in terms of Red Cross support for folks that are traveling, and a variety of other kinds of measures. I'll turn to Ian Stewart to speak to what those expenses are related to.
Mr. Chair, that line item refers to a variety of things that we're doing around the border for quarantine measures. We provide security, we provide medical backstops for our designated quarantine facilities, and we also have costs related to reception at airports and points of entry. So that item is a number. It's a bucket of things that are being covered.
Yeah, thanks, Mr. Stewart. Would you mind tabling that criteria or a list with the committee? That would be very helpful. Minister, is any of that $225.5 million going to be used for legal fees? And if so, how much of that has been allocated to that?
The money is, as Ian Stewart indicated, for very important components of the quarantine program and including testing. So this is direct supports for the quarantine program.
So none of that 225.5 million has been allocated to legal fees then?
I will get Ian Stewart to confirm that.
No, that money does not include funding for legal fees.
Has the minister, has money been put aside for the government to cover legal fees when it comes to hotel quarantines?
As the minister, I'm focused on making sure that we're doing our utmost to protect Canadians against the importation of the virus and the variants, and the additional quarantine measures are
just a yes or no. Then,
the additional quarantine measures are very important
so just a yes,
to understand whether or not travelers are arriving with COVID-19, and furthermore, whether or not the positive cases are variant. I'll turn to Ian Stewart for that answer.
No, that's okay. I got the answer. Thanks, Minister.
Well, actually, you didn't. So I can certainly turn to Mr. Stewart.
You avoided answering the question. You gave me. You're just trying to run out the clock. I understand that, Minister. It's fine. I have a constituent in Southern Alberta who's a lawyer and filed an action against the government on the hotel quarantines, and his argument is during the Oakes test that the government must prove that it has jurisdiction or is warranting an infringement on Canadian rights on the Charter of Rights and Freedoms, Section 6. He got a response from Health Canada and your department saying you will not relinquish any data that would justify the reasons for the hotel quarantine. Why is it your decision not to release that data that would show information on why the hotel quarantine is justified?
I'll turn to Ian Stewart to speak in general about the data we're collecting, but as this is a matter in front of the courts, it's not for me to speculate or discuss. Perhaps, Ian, you could speak about the data that we're tracking.
Yeah, no, for sure, I could speak about the data.
Just before you go to Mr. Stewart, the position was you are not going to release any information to help in the courts. So I haven't asked the question yet, Minister. If there is science and data that would warrant the reason for a hotel quarantine, that would say it is safer for a Canadian to quarantine a hotel as opposed to in their house, or this is a means to reduce the spread of the virus, why would you not want to share that information with Canadians to be transparent? Why are you refusing to share that information?
As the matter is in front of the courts, we don't respond.
Okay. Well, I think if you were, if this wasn't a political decision, you would have been happy to share that information.
No, as a matter of fact, I'll just negate that. We don't respond to matters in front of the court.
This was before it was in the court. We've asked this question before, and you've refused to answer it, Minister. So to me, this has nothing to do about a court
Thank you, Mr. Barlow.
Thank you, Mr. Chair.
We go now to Mr. Kellaway. Mr. Kellaway, please go ahead. 5 minutes.
Thank you, Chair, and hello to all the witnesses. Again, there's so many people to thank as we go through an unprecedented pandemic, and you're one of the many on the front lines and behind the scenes, and in some cases in front of the camera and behind the scenes. So just a special thank you for people in my riding and myself. But my questions will be directed towards the Minister, and hello, Minister. I want to talk a little bit about healthcare services in rural and remote communities like mine here in Nova Scotia and Cape Breton Canso. Many of my constituents, Minister, do not have easy access to a hospital. Some don't even live in communities that have active clinics, but they still need to get the care they need when they need it. So I know that in your mandate letter, it instructs you to work with the Minister of Rural Economic Development to ensure that all Canadians have access to more health services. And I'm wondering if you can tell us more about the progress you're making on this file, especially in light of COVID-19. And the way I approach things is I want to give people an opportunity to answer and to speak. And I know somebody mentioned about running out the clock. I like answers that are thoughtful and introspective and empathetic and evidence-based. So consider this the time to do so.
Thank you very much. And through the chair, first of all, I just want to acknowledge the challenges that Canadians face in rural remote communities. And I know we live many, many kilometers apart, but in my riding as well, I have rural communities and remote communities that I serve. And you're absolutely right. The challenge of accessing healthcare services in these communities is profound. In fact, and this won't come as a surprise to the member, but people that live in these communities often have to travel multiple times per week back and forth to larger centers, in some cases for specialized services. Of course, many times to see anybody more than a GP, a person may have to travel. In some cases, there might not even be a GP in some of these communities. And so it is a significant gap. And I was very excited when I was first appointed minister way before the pandemic, in what feels like a lifetime ago, to work on this issue because I knew it so well as a MP representing rural communities. And in some ways, COVID-19 has been an asset, weirdly, for virtual access to primary care. Now, you wouldn't think that COVID-19 had anything good about it, but it did cause provinces and territories to quickly accelerate access, for example, to change their billing codes, to be able to allow doctors and a variety of other healthcare practitioners to bill for virtual visits. This has been a real breakthrough, I think, for rural and remote communities that struggle and will struggle, from my perspective, for very long time to hold on to professionals in their community. We know that oftentimes people don't want to relocate to small communities. We try, we have a million different ways, I think, in every province to try and lure people to these beautiful places and keep them, including by introducing them to wonderful potential spouses and having them marry and stay in that area. But unfortunately, it still is quite a challenge for some of these smaller communities. And so virtual care has proven to be a boon, actually, during the pandemic. And provinces and territories have realized just how much they can accelerate access to care. Now, it's not, ideal for every kind of care, but it really fills a gap for some of those primary care health services. And so in the estimates, we're asking for $47 million for virtual care, and it's part of a larger investment of $150 million. And that's to strengthen this work that's already begun as a result of COVID-19, to strengthen those virtual care systems and to really hopefully help the provinces and territories solidify this gain that they've made in really breaking through, I would say, a barrier in providing access to care in some very challenging geographical settings. Thank you.
Thank you, Minister. And that's a really, I think, great example of more prospects of working together with the provinces in a collaborative effort. So my next question is, we keep hearing about the tools provinces and territories have to stopping the spread of COVID-19, whether that's testing, contract tracing, PPE, public health measures, and of course, vaccines. We know that none of these are alone a silver bullet to winning the fight against COVID-19. But I think it's important for people out there watching. Can you explain a little bit more as to why there is no silver bullet to COVID-19 and the necessity of a multi-layered approach, and how do these measures work together? I think this is really important for Canadians to hear.
Well, it's such a wise question, and I really appreciate the question from the member, because it reflects sort of a deeper thinking about how complex disease prevention and protection is. And you're absolutely right. The member's absolutely right. There is no silver bullet. There are many tools, and some of them are stronger and some of them are weaker, and they all have, challenges. But I will say that it is about adding layers of protection to Canadians. So, of course, we need to be able to detect the virus. So testing and tracing and being able to put out the embers and the flames very quickly, as you might say. But also, we also need to have tools like vaccination, to be able to prevent the deaths that we've seen in long-term care and in other settings. We need to have strong measures at our border to protect against importation. And we have to have a heavy investment in research and science so that we can understand how the virus is changing and that our tools can keep up. I think Dr. Tam talks about this quite eloquently when she talks about the layers of protection that we need, both as a society and as individuals. Thank you.
Thank you, Minister, and thank you, Mr. Kellery. We go back now to Ms. Rempel-Garner. Ms. Rempel-Garner, please go ahead, 5 minutes.
Thank you, Chair. Minister, what benchmarks are you using to determine when you will end the quarantine hotel program? Or maybe more simply, do you have benchmarks right now that you're using to determine when you will end the quarantine hotel program?
We are carefully monitoring the data that we're collecting at the border from both the pre-test and the post-test arrival. The day 10 testing is just arriving now, and all of that data will help inform our next steps as we evolve our stance at the border.
So you don't have any benchmarks right now that you're using to determine when you would lift the quarantine hotel program?
No, that's not what I said. I said what we are doing is evaluating the data, evaluating the science, monitoring the variants of concern, so that we can better understand how we can protect against importation and follow the virus as it mutates and changes.
So what benchmarks would those be?
Well, they might be things like percent positivity. They might be things like the number of variants that are coming in. They include measures around quarantine adherence. There are a number of measures that we monitor.
And what of those benchmarks would you use to determine when you would lift the quarantine hotel program?
Well, this is an issue I'd like to turn to Dr. Tammany and Stewart on, because I think it's important that you speak
Again,
to the science.
we're 2 minutes in. Minister, you're the minister, okay? So you actually have to be able to communicate some of this stuff
Well,
to me.
thankfully, MP Garner, we have officials and scientists leading our way here in the country.
So what is
Very
it?
grateful
What is
for
it? Would
them.
you say that you do here then?
Well, certainly
Ms. Garner, I would ask you not to bully the witness.
I mean, actually,
the
this is
officials are
interesting.
here to assist the minister.
No, Chair. We're here for supplementary estimates. So she is saying, I think she's arguing that she can't answer questions. I think asking what she does is relevant when we're looking at things like salary lines. But I digress, and I'll go on to my next line of questions.
I think it's important that we remember that we have to display courtesy, proper fairness and courtesy to the witnesses.
And Chair,
and it is appropriate for the minister to ask officials to respond if they can give the appropriate answer.
Chair, I realize you might not like my questions, but I do have the right to ask them. I will continue. Minister, will vaccinated persons be exempt from any lockdown restrictions?
Well, I think the member knows, perhaps she doesn't, but the member should know by now that in fact, any kinds of public health measures at the local level are applied by provinces, territories, and local jurisdictions. So those are best posed to those jurisdictions.
But the minister does know that her officials and occasionally herself will make comments about provincial lockdown restrictions with regard to federal modeling on case projections, things like that. So I just find it odd that she doesn't have a plan. When you're asking for several $100 million, I'll continue. Do you have any benchmarks that you're using at the federal government to recommend to the provinces around lifting or continuing lockdown restrictions?
Provinces and territories work collaboratively together in a number of different ways. One way is through the Special Advisory Committee of Medical Officers of Health of each province and territory.
I asked about benchmarks. So we're a year into this, and you're asking for several $100 million today.
And they meet regularly to talk about the modeling that's happening nationally and the modeling that's happening in each province and territory. And then decisions are taken based on the risk perceived to those particular people in that particular province or territory in collaboration with local,
I would like my time back.
Local officials. Of course, it's very important that provinces and territories have the autonomy, given that they also...
Excuse me, Minister. Ms. Rumpel-Garner, you have a point of order?
Yes, I do, Chair, per Robert's Rules of Order that are contained in Boston O'Brien, have the right to direct questioning to the minister. So I will have my time back now. Thank you.
Now, Ms. Rumpel-Garner, I will decide about the time in my discretion. I would invite you, whatever questions you ask is up to you within reason, but you also are expected to allow the witnesses to respond. And we will, I'll make a small adjustment for this particular intervention and the one I made before, but please do express appropriate courtesy and fairness to the witnesses.
Chair, I think at this point, a year into the pandemic, when the minister is asking for hundreds of millions of dollars of federal taxpayer dollars to come to a supplementary estimates committee and not be able to answer some basic questions, it's her that's being discourteous. But I digress.
Point of order, Mr. Chair. It's not that the minister's not answering. The minister's not being given an opportunity to answer.
Thank you for your point of order, Mr. Van Bylen. We'll go back to you, Ms. Rumpel-Garner, and please carry on with your questions.
Thank you, Chair. Did you, Minister, ask or anyone in Cabinet phone the Biden administration to ask if we could have some of the doses of AstraZeneca that are sitting in the US right now?
Mr. Chair, I did not personally phone the Biden administration to ask for doses of AstraZeneca.
Minister, has your department been in contact with the Department of Finance with regard to budget development in tying specific benchmarks for ending lockdown restrictions to the upcoming federal budget?
Again, Mr. Chair, I think the member opposite is confused. The lockdown measures, as she refers to them, are not imposed by the federal government. These are public health measures that are taken by provinces and territories according to their own epidemic and modeling.
Thank you, Chair. But the minister does realize that the federal government has spent hundreds of billions of dollars on measures to pay for provincial lockdown measures. So doesn't she think that the federal government has a responsibility, given that they have tens of, thousands of people working on medical advice, to help provide benchmarks and modeling moving forward on when lockdown measures would be ended?
We have always told Canadians we'd have their back while they struggle so immensely in every single community, in every single province and territory. And that's exactly what we've done. We've been there for families, for businesses, for communities, and we'll continue to do that because you know what, Mr. Chair, that's the right thing to do for Canadians.
Just last question. Do you think that it's the right thing to do to provide some advice on ending lockdowns?
Thank you, Ms. Rempel-Garner. We'll go now to Mr. Van Bynen. Sorry, I believe it's Dr. Pawlowski. We'll go to Dr. Pawlowski for 5 minutes.
Yeah, thank you. And as you all realize, I tend to run down the clock all on my own with my lengthy questions. So let me first of all say, this is for Dr. Tan and Dr. Stewart. So I hope you listen. So I want to ask about therapeutics. Like all of you know that healthcare is primarily a provincial jurisdiction. However, I think we'll all admit the federal government has put billions and billions of dollars into helping the provinces in dealing with the pandemic. There's also a national therapeutics task force. So here's the question. The question's around benlifinimab, a monoclonal antibody made here in Canada by AbCellera. There have been several studies that have shown that it seems to be effective when used early in the disease by high-risk people and preventing them going on to have severe COVID. There's also been a number of other studies with other monoclonal antibodies. As infectious disease people have pointed out to me, there are no studies that have shown that it isn't effective. Now, the problem has been, at least in Ontario, is getting this treatment out to people. And it would certainly be useful, especially in a place like Thunder Bay where our ICU is filling up with COVID cases, but they've been unable to use it either. And this is all provincial. I know for a month, 6 groups across Ontario, 6 groups of infectious disease people were trying to access it, weren't able to access it. In people with transplants, they have a 20% mortality when they get COVID, but they couldn't access it. So all across Ontario, and I think all across Canada, people are having difficulties accessing this medication and with the funding to give it, because you have to bring people into heated tents or something and transfuse it over a couple of hours. So I think given the fact that this is a problem all across Canada, are we aware of this problem and what can we do to help the provinces in order to get out, I think, this potentially important treatment? And as for the certainty of its use, as one infectious disease person told me, he said he felt that an informed physician treating an informed patient should be able to use it, but it's not getting out there.
Dr. Pawlowski, maybe identify again to whom that question was addressed.
It was either Dr. Stewart or Dr. Tam.
I think if I can speak, Mr. Chair, I think perhaps questions on therapeutics might be best positioned to Dr. Tam or Dr. Lucas.
Thank you, Minister. Dr. Tam, if you like.
Yes, so Mr. Chair, this is a provincial issue. I think the federal government provided support and the drug is available to the provinces. So it is up to the individuals to access this through the provincial mechanisms. I do know that some provinces are using it under specific circumstances. It is a difficult drug to use for early illness because it needs infusion, and it's definitely difficult and under local circumstances. But it is up to the provinces and the individual physicians to access. The federal government's already provided that support.
Second question is about, there's a lot of concern about the increased spacing between first and second doses of Pfizer and Moderna, and the possibility with that increased distance between the two doses that potentially this could allow variants some selective advantage, perhaps increasing the interval works with the wild type, but perhaps not as well with the variants. How are we going to be tracking that? Because I understand, for example, in Ontario, when you get a vaccine, there is a database saying who got the vaccine. It's tied to your OHIP number and what vaccine you got. And also when test results come back, including tests for the variants, that's tied to the OHIP number. These two could be linked, and we could in real time follow and look to see whether whether increasing the interval between the two doses is adequately controlling the spread of the disease, and particularly the variants. Are we looking at that? Or are we investing in that?
Is that for Dr. Tam or for Dr. Lucas?
Dr. Lucas or Dr. Tam, sure.
Doctor, if you wish.
Yes. So first of all, let's just clarify that the virus mutates in its natural state, and we've seen the emergence of variants without any pressure from the vaccine. But vaccines, what they do is if you can reduce the number of cases together with public health measures, fewer cases means fewer ability for the virus to mutate. Now, of course, we have a number of mechanisms and studies that are foundational to the rollout of the vaccines, and measuring vaccine effectiveness is really key. And you've seen some of the data beginning to come out of BC and Quebec. Those mechanisms already in existence will keep monitoring that interval and the vaccine effectiveness over time as the interval increases. So that is already there. The other thing that we've done is increase the infrastructure for sequencing and screening for variants of concern. One of the key protocol is anyone who's got vaccinated, doesn't matter 1 dose or 2 doses, they need that, those samples need to be sequenced so that we can detect if there's any variant emerging. So, and now that capacity is increased really fast, much higher sequencing than we had, even a couple of months ago. Over 10,000, maybe 11,000 sequences are being performed last month. So I think that we'll be watching that really carefully, and we'll be able to provide that information.
Thank you, Doctor. And Doctor. We go now. Nous allons maintenant, Monsieur Thériault.
Mr. Thériault, the floor is yours. 2.5 minutes. 2.5 minutes, Mr. Chair? Okay. Well, I won't be able to ask all my questions in that time, but Minister, I have a lot of trouble understanding your logic and rationale when you say you're going to fix the pandemic and then you're going to address the provincial healthcare transfer payments, as if we were asking you to reinvent the wheel and develop a transfer program one already exists. The federal governments haven't done their share for 30 years when it comes to, and it's made their systems fragile. And in COVID times, this has created two classes of patients, COVID and non-COVID patients. And there are statistics that attest to this. There are statistics from the Department of Health on the Ministry of Health and Social Services in Quebec. Dr. Champagne, who is the president of the association in Quebec, says that we're living off our credit cards. It's going to cost us dearly as a society, both from a human and societal standpoint. Why? Because a late diagnosed cancer becomes a heavy burden to cure. Saying that we need to deal with the pandemic before we deal with non-COVID patients, that shows that you haven't learned the lessons that the pandemic has enabled us to learn. How can you stand behind that kind of logic, Minister?
I think the member is not interpreting what I say correctly. In fact, transfers aren't stopping, Mr. Chair. They continue. We've added.
Sont insuffisants.
But they're insufficient, Minister. They're inadequate. I'm talking about what the Fonds commun du Québec and other organizations have demanded, and they are saying that we can't continue to have a 3% indexation. The bare minimum needs to be 6%. The costs are at 5%. 2% isn't enough. We need 35% share from the federal government. You know that's what I'm talking about. You know full well.
Mr. Chair, I think the member knows that the transfers have indeed been increased over the past number of years and specifically focused on mental health, on home care, which is actually a good thing. Obviously, people need to be able to be supported to age at home now more than ever. And we've been there. No questions asked for the provinces and territories with billions of dollars in equipment and money and expertise, and now most recently in vaccines and the support to get those vaccines to the locations of the province's choice will continue to be there, as the member knows, for provinces and territories. The Prime Minister has been very clear. He understands that there will be investments in health needed as we go forward, but our focus right now is on getting through the pandemic.
Merci, Monsieur Thériault.
Thank you, Mr. Thériault.
Mr. Davies, 2.5 minutes, please.
Thank you. Minister, Dr. Quach Tran from NACI yesterday very bluntly said that Canada's had to effectively take rationing measures for vaccines, basically because of a lack of supply. She was very clear about that on several occasions. And one example of the rationing is the extension of a second dose to 4 months. Now, your government has repeatedly said it relies on science, but Canada's chief science advisor, Dr. Mona Nemer, who's presumably advising your government, said the following with respect to that. It amounts right now to a basically population level experiment. I think it's really important that we stick with the data and with the great science that gives us these fantastic vaccines and not tinker with it. And then last week, the Pfizer Canada president said this about the 4 months. The fact is we don't have any data after 2 months to know what the impact of one dose will be. So as health minister, can you tell us how it is respecting science and data to have a recommendation from Health Canada to extend doses to 4 months in light of that advice and opinion from NACI and your chief science advisor?
Mr. Chair, I'm sure the member opposite is not trying to confuse Canadians, but in fact, his question is full of incorrect premises. It's not Health Canada that makes these recommendations. Health Canada approves vaccines. NACI is an independent, science-based advisory body. Dr. Carolyn Quach is an expert in the field of immunology and vaccination, as are many other members. And this is independent advice that's provided to provinces, territories, and other interested stakeholders. And that advice can be applied should province and territory choose to use it.
Okay.
Dr. Tam is active participant in those conversations, but again, this is, as I said, independent of government decision making.
Well, the only confusion that we heard yesterday is confusion when Health Canada says that you can use AstraZeneca over 65 and NACI says you can't. I mean, there's a lot of confusion, but I just want to turn quickly to the opioid crisis. In 2020, 1,716 people died of overdoses in BC, the deadliest year on record. Opioid deaths have risen every single year that the Liberals have been in power since 2015. And BC's provincial health officer has repeatedly called for the decriminalization of substance use and provision of safe supply. In February, BC's Minister of Mental Health and Addictions wrote you a letter requesting a province-wide exemption under the Controlled Drugs and Substances Act to save lives. Will your government finally listen to public health experts and science and grant this exemption without delay to save lives?
Thank you very much. And through you, Mr. Chair, in fact, there was yet again a false premise in the member's opening statement. In fact, opioid deaths declined in Vancouver just prior to COVID-19 striking. And that was, I think, in due part to a commitment both by the province of BC and the federal government to increase access to safe supply and safer consumption sites to restore harm reduction to the Canada Drug Strategy and to take a number of other measures besides approving the House of Commons, of course, the Good Samaritan Act that was presented by your chair, which ensures that people who call for help of someone who's overdosing won't be criminally penalized to do so. Listen, a lot has happened in this space, and of course, we're working with the province of BC on their request. I spoke with Minister Malcolmson just last week, and of course, Mayor Stewart to speak about their plans, and we're working on the framework as we speak.
Well, thank you, Mr. Davies, and thank you, Minister, for the plug. We'll start round 3 now. Thank you all. We'll start round 3 with Mr. Maguire. Mr. Maguire, please go ahead. 5 minutes.
Thanks, Mr. Chair. I just want to go back a bit. We had President of Pfizer on here the other day and on Monday, and the minister knows full well. The situation is that President of Pfizer said that negotiations began for vaccines for December delivery back in November. Why?
Well, I think the president of Pfizer was speaking about December deliveries when it became obvious that it was possible. But listen, we began
the government was going to get these
negotiations.
vaccines. Pardon me. The vaccines were going to show up in February.
I'll turn to Ian Stewart, who has more intersection with.
Well, I just want to know: are you saying that like this started in mid-November? Are you saying that the president of Pfizer was lying with his comments?
Maybe I can turn to Ian Stewart to speak about our work
or
on
you don't
procuring,
know.
but maybe I can turn to the official who can speak about our work on procurement. As you know, the member knows
we
I'm
heard from
not the
him.
Minister of Procurement. We were actively engaged in procuring vaccines very early, and I'll have President
No, you
Stewart
weren't.
speak.
You were months late. That's why you were
Point of
negotiating
order,
this in
Mr.
early
Chair,
November.
please allow us to hear the answer.
Thank you for your point of order. Please,
The member is asking about our negotiations with pharmaceutical companies. I'll turn to President Stewart to speak about those. President Stewart?
Yes, as the minister has indicated, PSPC does the negotiation with the pharmaceutical companies, not us. Once they're procured under contract, they're delivered to us, to Danny Fortin, who's here with us today. In December, we received several 100,000 doses of vaccine. December 14th was the commencement of the national immunization campaign at 14 points of delivery across the country. That's when it commenced at that time.
Yeah, my question was, and the president of Pfizer said those negotiations started in mid-November. They were moved up because of the contract was originally for first quarter of 21, and they were moved up. That's what he said. His testimony is such, and so therefore they were delivered in the middle of December, and thank goodness. I mean, we got some vaccines finally, but I'm just asking those negotiations. Now, I'll go on to another question.
Mr. Chair, perhaps I could respond to that.
I didn't ask a question, so I will ask a question.
Well, there was some incorrect information. I'd like to correct the record.
Or you're saying
Chair,
the president of Pfizer is wrong then?
We
Mr.
were one
Maguire,
of the first.
I'd ask you to let the minister answer the question and the assertions that you've made.
Well, thank you very much for the moment to just respond, Mr. Chair. We were one of the first countries in the world, in fact, to secure approval of Pfizer and Moderna and begin early immunization. It's really quite a story of perseverance on behalf of my colleague, Minister Anand, and of course, many others, including President Stewart and Major General Danny Fortin. And I want to thank them for their incredible hard work.
Yeah, I get that, and I give them credit for that work. But the government was 3 months late negotiating last spring, and so therefore they got delivery of vaccines in their first contract for the Q1, and then they had to go back and renegotiate it. So that was clearly evidence from the testimony that the president of Pfizer made here on Monday at this committee. There's about 60% more opioid deaths in Canada since COVID started, particularly in the province of BC. There's over 330,000 elective surgeries that have been delayed in Canada because of COVID. You've got $4.2 billion of lapsed money in this budget that I see here in Public Health Canada, or Public Health Agency of Canada alone. $2.5 billion for medical research and vaccine developments, 1.7 lapsed in protective gear and medical equipment. Are you using any of those lapsed dollars in regards to making sure that we have a plan for recovery so that we can get back into getting those elective surgeries in place before more people die?
Mr. Chair, I think the member does not realize that, in fact, the provision of direct medical care is the responsibility and the right of provinces and territories.
But you've lapsed $4.2 billion and they're asking for more money. I know the provinces could deliver this. They would do it. There's places in the world where vaccines are being delivered 24/7. That's because they have vaccines. We're not doing that in Canada because we don't have vaccines. So it's very frustrating for the provinces. I'm sure the minister has been in touch with them, or the prime minister has, and understands that. In fact, the prime minister said he talked to them 28 times this morning. But we still don't have those vaccines on enough of a delivery mechanism that we can do it on a 24/7 basis. We need to ramp up. We will ramp up, but we're months late. And I guess I would just ask the minister when that plan will come out as to how these people who are expecting elective surgeries or been placed on elective surgery lists can expect to get them.
That's a great question, Mr. Chair, for the Premier and the Minister of Health of Manitoba, who I'm sure are managing their caseloads and their
This
their
isn't about Manitoba, Madam Minister. It's about Canada and Canadians that are waiting for elective surgeries. And these numbers aren't just for Manitoba.
In fact, as the member may not realize, healthcare is the responsibility and the right of provinces to deliver, and we'll be there for provinces and territories.
Ms. Maguire, please do not interrupt the minister.
Delivering on their responsibilities. Thanks, Mr. Chair.
Thanks. Thank you, Ms. Maguire. We go now to Mr. Van Bynen. Mr. Van Bynen, please go ahead. 5 minutes.
Thank you, Mr. Chair, and thank you, Minister Hajduk and health officials for joining us today. It's always great to hear from you on what we're doing to protect the health of Canadians, especially while we continue to fight this virus. Minister, I want to ask you about our vaccine rollout, since you were so rudely interrupted when you tried to respond earlier. Vaccines are top of mind now for most Canadians, and our government has been instrumental in delivering vaccines to provinces and territory. Now we're seeing over 1 million doses arrive every week. Can you tell us more about the work the federal government has done to get vaccines to the provinces and to the territories?
Well, thank you very much to the member for this question. And I just do want to give a huge congratulations to everyone at the Public Health Agency of Canada, and in particular Major General Danny Fortin, who's been instrumental in the vaccine rollout with provinces and territories. It's been efficient and organized, and I know he's working really hard. Perhaps I could give him a couple minutes to speak about his work with the PTs.
Mr. Chair, thank you very much. And it very much is a team effort. And we work closely with provinces and territories, as well as with other federal departments, to ensure the most efficient rollout as possible. By the end of the day today, we'll have nearly 4 million doses distributed across the country. And provinces and territories are working on scaling up. And we've ensured that we provide them as much predictability as possible in terms of doses arriving and when, with forecasting projections as well, or forecasting tools to help them visualize what they will receive and when in the different types of scenarios. And we'll continue to ensure that we respond to any requests they would have, none at this time, but any requests they would have in terms of repositioning or buying additional cold chain enabling equipment. And I should say that we also share a lot of best practices amongst provinces. We've shared administration model playbooks just a week ago, and they're very much looking at different modalities to distribute their vaccines.
Thank you. Minister, given the limited supply in the entire world to get vaccines, are the recommendations by NACI and Health Canada unsafe?
Well, thank you, and through the chair and to the member, that is a question that's best placed to Dr. Tam. These are scientific recommendations made by experts for the use of provinces and territories. And, our government, as you know, has been guided by science and evidence in our response. So perhaps I can turn to Dr. Tam.
If I could add, are we putting Canadians at risk with these recommendations?
Dr. Tam?
From a regulatory perspective, Health Canada takes extreme seriousness and high standards in reviewing the data in front of them, which a lot of it's the clinical trials, tens of thousands of persons studied, that they are safe and effective, of high quality, and that the benefits far outweighs any risk. That is the bottom line. The National Advisory Committee on Immunization also takes into account the data, but also in addition provides a lens on looking at all the vaccines together, as well as the epidemiology of where Canada is at, who's at the highest risk in terms of risk factors, and feasibility, acceptability, ethics, and equity as they make their recommendations. The bottom line, though, is that any recommendation they may, of course, takes into account vaccine effectiveness and safety. So that is how they provide recommendations. And I think, as you've seen, the provinces and territories, through their chief medical officers and their vaccine programs, are essentially aligned with the NACI recommendations as well. So I think Canadians should feel confident that the vaccines provided are effective and safe.
Thank you. Over the past few weeks, we've heard from various witnesses and experts about these COVID-19 vaccines and recommendations. We've heard a lot of scientific terminology, some of which we are familiar with, some of which we are not, such as the public health officials, such as the ones that the public health officials use to talk to each other. Minister, I'm wondering if you or anyone of your health officials are able to clarify the difference between efficacy and effectiveness, clinical trial results and real world results. And if we have time, the different roles of PHAC and NACI and the role that they play in immunization. I'm actually seeking for the type of definitions that people would understand at the grassroots level.
Well, thank you. It's a great question. And I think, again, I will turn to Dr. Tam. There are some aspects of your question that are more easily explained than others, but I will agree that there are a lot of terms flying around, and we want Canadians to have as clear of information as possible. And that's why we're grateful to Dr. Tam for her daily or very frequent pressers to Canadians, letting them know all things COVID. Dr. Tam?
Well, I'm very happy that people in Canada have significantly elevated their knowledge base and scientific acquisition of that knowledge. And so vaccine efficacy is generally used to describe the data coming out of clinical trials that are done in very specific circumstances under a great deal of protocols. And they're generally done, as you've seen, in phase 1, 2, and 3 trials, escalating to phase 3 with tens of thousands of patients enrolled, where they compare those who are vaccinated and those who have received a placebo or another vaccine to see what the final outcome is. And that's how you get the really high effective rates, highly efficacious vaccines, or the results coming out of those trials. And and the safety also is monitored through the clinical trials. Then after authorization by regulatory authorities around the world, the vaccines are then deployed in the millions and tens of millions as it stands all around the world. And the real life on the ground performance of the vaccine is called vaccine effectiveness. And in general, one might expect it to be a bit lower than what you find in well-controlled environments. And so those are the real life in-field, you got to give the vaccine under different circumstances, different populations, some in the remote areas with different logistics. And what is really very heartening is that the real life on the ground data is really good as well as it stands. And some of them are coming out of British Columbia, Quebec, Ontario, demonstrating in real life the vaccine effectiveness, particularly right now in reducing long-term care facility impacts in a very significant way. So that's effectiveness. And safety is also.
Excuse me, Dr. Tam. I'm sorry, I have to cut you off there. Thank you.
Thank you, Mr. Chair.
We go now to Mr. Barlow. Mr. Barlow, please go ahead. 5 minutes.
Thank you very much, Mr. Chair. And Minister, we had some interesting testimony from NACI last night. I know my colleagues have touched on that, but Minister, do you agree with NACI's testimony last night that the failure to procure enough RNA vaccines by the Liberal government has forced them to provide off-label use recommendation for the Pfizer vaccine?
It's not my understanding that that was the testimony of Dr. Carolyn Quach. I'll turn to Dr. Tam to speak to that question.
Well, Minister, I'm asking you, you know, the buck stops with you. This was exactly what NACI
Mr.
said
Barlow,
last week.
it's up to the minister to decide how to answer the questions you pose to her. If she wishes to
I'll
ask
turn to
her,
Dr. Tam because
Mr.
Dr.
Chair,
Tam, as
Mr.
you
Chair,
know,
it is my time, and I am
interacts with-
posing the question to. I'm asking the minister personally. Does she agree with that testimony from NACI? And I am not manipulating NACI's testimony. NACI's testimony last night was that the failure to access enough vaccines early on forced the decision to change the access to the Pfizer vaccine off-label to extend that second dose. That was her testimony. I'm asking the minister, does she agree with that testimony?
Thank you, Mr. Chair. I would like to turn to Dr. Tam, given that she is a medical expert and I am not. NACI is comprised of medical experts, and she interacts with them.
Okay, I'll just move on. If you're not going to take, you know, you're the minister. You are
Mr. Barlow. It is up to the minister to decide how to answer the
Mr.
question.
Chair, I am asking the minister a question, and for her opinion on that question, I will move on. Mr. Chair, I will move on.
Mr. Barlow, I will refer to you to page 30 of Bosch and Gagnon, which identifies it is up to the minister. The responsibility is to the minister to answer the questions appropriately and to call on officials as appropriate to do so. If you ask the question of her, it's discourteous to not let her answer. So I'll stop your time briefly, but I would ask the minister. The minister has asked Dr. Tam to respond to your question, so I will invite Dr. Tam to do so.
I'll turn to Dr. Tam to talk about the NACI advice.
Yeah, so the central foundation for the NACI advice is the high effectiveness and safety of that first vaccine dose. That is absolutely what they base their recommendations on.
Okay,
not
thank
only
you, Dr.
that.
Tam. Yeah, thank you, Dr. Tam. I appreciate it. I'll just move on to my next question. Minister, does the off-label use of the Pfizer vaccine contravene any section of the agreement we have with Pfizer for the use of their vaccines?
I'll turn to Deputy Lucas to talk about the regulatory approval for Pfizer.
Thank you, Mr. Chair. Health Canada makes its regulatory decision against the standards for safety, quality, and efficacy based on the clinical trial data provided by the manufacturer, in this case, Pfizer. In terms of the practice of medicine and how it's used, in Canada, we have the National Advisory Committee on Immunization, which provides advice on the use of vaccines as they've done for Pfizer and Moderna and AstraZeneca to date. And in that context, they take into account the clinical data and other considerations from a public health perspective and real world evidence if it's available that allows them to provide that advice for the use of the vaccine in
Mr.
a
Lucas,
real world setting.
I just asked, does it contravene any aspect of the contract we have with Pfizer? That is a very simple question. It is yes or no. But I'll move on to my next question. Has any consultation been done with the insurance companies in Canada when it comes to our health insurance? Does extending and going off-label from the recommendation on the vaccines, does that impact eligibility for health insurance? We have certainly heard from constituents that have had those conversations with their health insurance provider that if they are vaccinated using the vaccine off-label, off the recommendation, it will invalidate their health insurance should they pass away or have a health issue as a result of COVID. When you made the recommendation to go off-label, did you have those consultations with Canada's health insurance providers?
The NACI recommendations are not made by the government. They're made by an independent advisory body, and then provinces and territories can choose to use that NACI guidance to direct their actions in terms of their vaccination priorities and practices.
Thanks, Minister. But you know, there is some responsibility for you as the minister and as the government to oversee decisions that will have a massive impact on the Canadian public. If NACI makes this decision, I would suspect that you as the government would also take the prerogative to have those discussions with, for example, health insurance providers. but clearly you did not see that as an issue. But I'll move on to my last question. We know the WHO and FDA have minimum standards when it comes to efficacy guidelines. Does Health Canada have a minimum efficacy standard?
Yes, there are a variety of standards that very rigorous standards, I would say, that any drug or medical therapeutic needs to go through before it's approved by Health Canada. Dr. Lucas, can you please take this question?
Yes, Mr. Chair. In November 2020, Health Canada did publish our standards in terms of safety, quality, and efficacy and that were expected for vaccines. The efficacy standard is at least 50%.
Right. Okay. Thanks. That's the answer I wanted. So why did the government approve AstraZeneca for use with Canadian adults over 65 when its efficacy is below the standard that you set of 50%? It's 43%. Why would you approve a vaccine for use in Canadians that is below standard?
I'll turn to Dr. Lucas, but there are some misrepresentations in the question. Dr. Lucas?
Mr. Chair, in considering the regulatory decision in regard to the AstraZeneca vaccine, the regulator considered the evidence provided through the clinical trials, as I noted, and additional evidence provided through real-world experience, including as demonstrated through structured studies. And on the basis of that, it determined that the benefits outweighed the risks and authorized the vaccine for use in people 18 years.
But the minister can't say what I said was wrong.
Thank you, Mr.
The
Barlow.
data says 43%.
Thank you, Mr. Barlow. We go now to Mr. Kellaway. Mr. Kellaway, please go ahead. 5 minutes.
Thanks, Mr. Chair, and it's great to be back to ask a few questions. My first question is for the minister, but Minister, you and your colleagues have a great team, so if you want to ask others to join in, please do so. My question is around variants of concern. So we know that these variants have taken hold in Canada and are spreading in different parts of our country. So I guess my question is twofold. How are we tracking these variants, and how are their presence changing our response, our government's response to COVID-19?
Oh, thank you very much to the member. And he's absolutely right. We are taking a multi-layered approach to keeping Canadians safe. And obviously, everything we do has to be in partnership with provinces and territories as they deliver healthcare in their own jurisdictions. And they have the right and the responsibility to do that. So as part of our work to support tracking variants, we've invested $53 million to create a variants of concern strategy, which will increase monitoring and surveillance of new COVID-19 variants in Canada. I think you heard Dr. Tam say that work has accelerated extremely quickly, and we're testing positive cases across the country to get a better handle on where these variants of concern might be. Obviously, partnering with experts in research and public health. And this is a very important piece of work, especially right now as we stand at such a critical point in our battle against COVID-19, including vaccinating Canadians.
Would anybody else like to join in?
Maybe I can turn to Dr. Tam, because it is quite incredible what has happened in the last couple of months in terms of our ability to track these variants of concern.
Thank you, Minister.
Yes, so even prior to the acceleration of the capacity, we were doing quite well compared to other countries, and now we're sequencing, whole genome sequencing over 10% of our cases. Provinces, vast majority are screening for mutations for 100% of their positive cases. That's a great milestone. Just to say that variants of concern are increasingly identified in Canada, and we now have like 3,000 cases of them, and in Ontario and other spaces as well. And you've seen some of the latest data coming out of Ontario that about 40% of their cases are now variants of concern, mainly of the B117 variant, with increased transmissibility as they've shown in their modeling and their data, and certainly concerns about increasing severity. So of course, how we manage these does have to be adjusted according to that data, and provinces are easing their measures very carefully. And I think I've seen commitments for them to, clamp down on the variants as they detect them. But I think we're in a better spot in terms of detection.
Thank you so much, Dr. Tam. I'm going to go back to the minister. Minister, I'm a huge advocate for seniors in my riding. I know my colleagues are huge advocates for seniors in their riding. My favorite senior is my mom. And as you know, she's a huge fan of yours. Seniors like my mom have felt the impacts of this pandemic like we all have. But our government has stepped up to the plate to help seniors. But I'm wondering if you could tell us and tell those that are watching more about how we supported seniors through these challenging times. If you can give the sense to us and those watching what we've done.
Well, thank you very much. And please say hi to your mom for me. I have never met her, but she sounds like a wonderful woman. And I've enjoyed your stories of her. I'll say that we knew right away that seniors were going to struggle, especially since seniors often face isolation in particular already. And when we were asking people to stay home and to avoid going out, for those seniors not living in long-term care, it would be difficult. But for those in long-term care, obviously even more so. We worked very closely as a whole of government to increase access to financial supports for seniors, to ensure that New Horizons programs across the country had additional money to rapidly change how they were connecting seniors and communities. Obviously, all the work that we did to support provinces and territories in long-term care work was very, very critical. And we'll continue to do that work for seniors. You know, when I think about the seniors across this country that have been there for us in our toughest times, it's time for us to be there for them. And that's why I'm so honored to be Canada's health minister and working on the many ways that our government can support seniors to have healthier, more dignified lives.
Thank you, Minister.
Thank you, Mr. Killoray. Monsieur Thériault, c'est à vous maintenant, 2 minutes et demie.
Mr. Thériault, the floor is yours, 2.5 minutes. Just 2.5 minutes, Mr. Chair. Oh dear. Minister, just let me fill you in about the realities faced by the provinces in Quebec. I know it's not a federal area of jurisdiction, healthcare, but perhaps you're disconnected with what the reality was on the ground that created the first and second wave. The report from the ministry, as I said, indicated that there were 4,000 undiagnosed cancer patients in Quebec in the first wave. Over 1,000 surgeries were, in fact, dropped off the list. Radiotherapy services, 9% drop for the same period. Screening against prostate cancer, a 58% drop. Lung cancer, which is the main cause of death among women and men. The MRIs and screenings to diagnose that cancer dropped by 21% over that period. That's what non-COVID patients are. Surgeries dropped from April to June 2020 significantly. Colorectal cancer, same. Very widespread throughout the pandemic, and yet there was huge drops in terms of diagnosing this cancer. And surgeries for colorectal cancer dropped by 30%. I could continue, breast cancer, so on and so forth. And that is what the Director General of the Quebec Cancer Association said, Mario Dessay. He said that the figures risk being worse, even worse in the second wave. And this report was published late January 2021, and the figures will be even worse for the second wave. And you have the gall to tell us today that we first need to address the pandemic, as if it was a dichotomy, as if the reality that I'm just talking about now wasn't urgent, when we know full well that it's the transfers that will help to address those. What are you going to tell to undiagnosed cancer patients? Are you going to tell them that it wasn't in your purview and that you had to address the pandemic first?
Well, first of all, to the Member of Parliament, my heart is with all Canadians who have sacrificed and struggled and dealt with this pandemic in ways that we can see and ways that we can't. But I will remind him that the provision of healthcare rests with the provinces and territories, and we've been there to help them deliver on historic demands on their healthcare systems. In fact, As the member knows, we've paid for personal protective equipment. Billions of dollars have been transferred directly to provinces so that they can augment many capacities that they've needed. We've also supported seniors in long-term care. We've supported the infection prevention control in schools. We've been there for the acquiring of vaccines and many other therapeutics, paid out of pocket, no expenses to the provinces and territories for testing, including rapid testing. Every step of the way, I have worked with Minister McCann first and Minister Dubé, receiving calls for urgent supplies and been there for the province of Quebec, as the member knows. We're going to continue to...
Well, what about just increasing healthcare transfers to the provinces? You know that that's what we need. Thank you very much.
We go now to Mr. Davies. Mr. Davies, please go ahead. 2.5 minutes.
Thank you, Mr. Chair. Major General Fortin, what is the maximum number of doses per week that the provinces and territories are currently capable of administering?
Mr. Chair, thank you. It depends. There's a number of efforts ongoing to increase and scale up in terms of health workforce. All provinces have different modalities of delivery, and they're continuing to investigate that. So we're providing projections so that they can align all the resources necessary, and they've assured us that they are on track to meet the demand.
Does anybody appearing before us, can anybody give me a number on what Canada's national vaccination maximum number of doses per week we can administer? Mr. Stewart, I see you nodding your head.
Yeah, through the survey work that we've been doing, the provinces have given us ranges. And so we could give you a range based on those outreaches, Mr. Davies.
Do you have those ranges with you, or can you supply this to the committee?
We could definitely supply it to you, and we will do so.
Thank you. Major General Fortin, the reason I asked that is that you have noted that Canada's vaccine program is moving into a significant ramp-up phase. Where was your phrase? We know that about 3.8 million doses have been distributed to provinces and territories in the last 13 weeks. About another 4.2 million will be distributed in the next 3 weeks alone, and we have an announcement today of that Pfizer may be delivering 1 million doses per week for the next 7 weeks. So are you confident that all provinces and territories are prepared to rapidly administer this number of vaccinations over the next 7 weeks?
Mr. Chair, provinces and territories have assured us that they have good plans in place and they have the health workforce required to scale up. So They indicate that they have no issues with throughput, and we'll continue to monitor that as closely as possible with them.
Okay, that's good news. Hope we'll keep our fingers crossed. Minister, this committee has heard evidence from a number of sources that vaccinating the world's population is important for Canadians' health, primarily because the faster that the world is vaccinated, the quicker that we can control variants. So we know it's important for equity of access, but also to control the spread of variants in Canada. Yet Canada this week refused to support the proposal at the WTO to temporarily reduce patent protection so that we could have vaccines produced by every country of the world. As health minister, do you agree with that position that Canada's taken at the WTO, or do you think that we should be seeking to make sure that the world can vaccinate its population as fast as possible to protect the health of Canadians?
We agree that Canadians need to be vaccinated, and so does the world population. That's why we're a major contributor to the COVAX facility. That's why we've been having regular conversations with the World Health Organization about Canada's role in ensuring that global citizens across the world get vaccinated.
But our position at the WTO, do you have a comment on that?
Davies. Thank you, Mr. Davies.
I guess not. Okay, thank you.
Sorry. That brings round 3 to a close, and it looks like we'll have just enough time left to actually conduct the vote.
Point of order, Mr. Chair.
Yes.
I want to raise an important issue for future meetings, Mr. Chair. The rules are clear. The witnesses should be given an opportunity to answer the question. Member asking them. Can we please ensure that all members are following this rule? Thank you.
Well, thank you for the point of order, and I certainly have advised all members to do so, and we shall keep on that going forward.
I have a point of order too, Mr. Chair. I mean, perhaps we could also.
Mr. Chairman, I have a point of order too, says Mr. Thériault.
Go ahead on your point of order, Mr. Davies.
Thank you. Well, the quid pro quo of that, of Ms. Sidhu's comment, is that the witnesses are instructed that they should answer the question being asked, and that would I think help all committee members as well.
Thank you for your intervention on the same point of order. Thank you, Mr. Davies. And noted. And we will undertake the vote now.
On a point of order, Mr. Chairman.
Same point of order.
On that particular matter, yes, indeed, Mr. Chairman. I'd just like to clarify that when we have 5 minutes at our disposal and the government party has all the time at their disposal to ask questions, well, perhaps it's okay for witnesses to take their time, but when you have 2.5 minutes to ask a question and the witness goes off the beaten track, well, then they need to get back on track. And that needs to be understood because, the Liberal Party gets a lot of time for questioning in comparison to myself and Mr. Davies. So witnesses just have to understand the way things are. When you say that we have 2.5 minutes on the clock, it's not about, avoiding questions. It's just about making good use of our time. So I'd just like to raise that point of order, Mr. Chairman, because on occasion you could remind witnesses to ask them to answer questions more directly. You call us to order in relation to letting witnesses respond, but you should also call witnesses to order. But that said, I say that in good humour and with kindness.
Well, thank you, Mr. Thériault, and I would certainly remind Mr. Thériault and all the members that the time allocated for speaking is a matter that was decided amongst all the whips and determined in our routine motions back when we started this committee after the in this session. It's certainly I think it is certainly the prerogative of the chair to recognize people to speak or not. During questioning, we typically allow the members to control the flow during their own questioning. But if that is abused, then the chair has to take action. Certainly, I would advise all people and all members and all witnesses to answer the questions as best they can. But I would also remind members to not put words in the witness's mouth or try to impose specific sets of answers on them. The answers are the prerogative of the witnesses. I would also remind people that when the minister appears, she appears with officials whose job is to support her, and it is her prerogative to pass the question to them where she feels that the question is more appropriate. And is there any further intervention on this point of order? Seeing none, let us once again go forward and conduct the vote. So the first one is shall vote 1C under Canadian Food Inspection Agency carry. I will ask the clerk to do a roll call.
On division.
Very well, thank you. Vote 1C is passed on division. Shall vote 5C under Canadian Food Inspection Agency carry.
On division.
On division, very well, thank you. Shall vote 5C under Institutes of Health Research Agency carry. Is that on division also? On division, thank you. Shall vote 1C under Department of Health carry. On division?
On division.
On division. Shall vote 10C under Department of Health carry.
On division.
On division. Shall vote, I forget where I was. Shall vote 1C under the Public Health Agency carry.
On division.
Thank you. Shall vote 5C under Public Health Agency carry.
On division.
On division. Shall vote 10C under Public Health Agency carry.
On division.
On division. Thank you. Shall I report the votes on the supplementary estimates to the House? Do we want to do that on division, or shall we have the vote?
On division.
On division, very well. Okay, thank you all. That concludes the business before us today. I would like to thank all of the witnesses. I would thank the minister and her officials. I know how exhausting your schedules are, so I really do appreciate the time you spent with us today and your expertise and your knowledge. So once again, thank you, and thank you to the members. And with that, we are adjourned.
Have a nice